Hi, I'm Dr. Dan Thompson from OrthoVirginia, and welcome to our Facebook Live today. For those of you who may not know OrthoVirginia, we are part of the largest multi-specialty orthopedic practice in Virginia, and I practice in Northern Virginia, but we have offices in Richmond, Lynchburg, Southwest Virginia, and Virginia Beach. Well, I don't want to spend my time talking about our group. What I'm more interested in is telling you about ACL tears today. If you're interested in our practice, please feel free to go to our website, orthovirginia.com. So let's get to talking about you and what matters to you, a topic near and dear to my heart. ACL treatment options. So growing up in Mississippi and playing competitive soccer, I did lots of traveling and playing soccer and was just fine up until after college. When playing indoor soccer, I had the infamous misstep and a pop and a swollen knee. Lo and behold, I had torn my ACL. And so I got to know what this felt like from the inside. So, before I jump into telling you more about this, I just want to remind you, if you have friends or family that might be interested in this topic, please go ahead and click the share button below so they can see our topic, and if you want to watch this later, this should be recorded for future viewing. So, I guess for starters, what is the ACL? The ACL is the anterior cruciate ligament, and it is a large ligament that runs between the two bones of the knee, the femur and the tibia, and in a diagonal fashion, and provides stability to the knee for both rotation and for the tibia shifting forward in relation to the femur. When it gets injured, it typically is a hyperextension type injury, and the ligament tears mostly in the mid-substance of the ligament, but sometimes can tear more on one side or the other. The problem is it doesn't tend to heal very well or very reliably. So, the treatment options have been developed over the years based on what works and what doesn't. Non-surgical treatment tends to be best for people who might be older or less active or already have some arthritis to begin with. There actually have been some studies more recently that suggest there may even be some people who don't have an unstable knee without an ACL. And those people might be reasonable to treat without surgery too. However, the vast majority of people do best with surgery. So, the big question with surgery is, when is surgery right? Traditionally, a lot of knees have gotten very stiff with surgery early, and so that in itself is a huge problem. So we as orthopedic surgeons have tried to push that out at least 6 weeks or more before operating on knees with an ACL tear. Some newer research suggests that you actually might do a bit better with an earlier surgery timing, even as early as less than 48 hours after injury. However, I would say the norm and what I like is a knee that has good range of motion and has not that much swelling and good quadriceps strength. So honestly, for most patients I see who've torn their ACL, I think the most important thing early on is to work on getting the knee moving. Try to get a full range of motion, try to get your quadriceps muscle working as well as possible, whether that's stationary bike or even doing squats. Those are good things to do even before surgery, which most people are surprised that you can do with torn ACL, but indeed you can. Then the time comes to surgical treatment. Historically, way back when, people tried to sew the two ends of the ACL back together. That was destined for failure and didn't work. It stretched out. It was definitely not a good solution. Interestingly enough, though, there is a new procedure that is not yet FDA approved, but undergoing study called the Bear procedure. And with that, that involves actually sewing the ends of the ACL back together and then wrapping a sponge around the repair that's soaked in growth factors that seem like it may make it more likely for the ACL to heal reliably. I would say stay tuned on that in terms of whether it's a good choice or not. The more traditional workhorse approach is reconstructing the ACL and putting a new ACL in, which in basic terms involves drilling some tunnels that go up through the tibia and exit at the base of the ACL, and then another tunnel up through the femur, and then threading a new ACL into those tunnels and fixing it on either side. So where that graft comes from is really the big question. That, again, historically was at one point done with a synthetic graft. And again, those are just not strong enough or durable enough to be used in people and go back to sports. And so that has been entirely abandoned. So really at this point, the big two groups are allografts and autografts. Allografts are grafts that are taken from a cadaver, a dead person, and are used, and obviously the least painful option. Autografts are taken from the patient themselves. And so that is where a lot of the debate comes in. An allograft is the least painful option, but does have the slowest healing. And so for that graft to grow in and become solid can easily take 6 months. Whereas with some of the other options, it can be a bit faster, even as soon as 4 months. So the workhorse graft is the patellar tendon or bone tendon bone graft, which entails making an incision in the front of the knee, and I take a portion of the patella, the kneecap, as well as the center third of this patellar tendon that comes down, as well as a bone plug from the top of the shin bone, the tibia. And so what we end up with is a graft that has a bone plug, a tendon, and a piece of bone. That tends to heal very reliably and very well, but is also the most painful graft. It tends to come with a lot of pain in the front of the knee and difficulty kneeling afterwards. It also is one that can be associated with the risk of fracture of the kneecap because we've taken a chunk of the kneecap out. Another option is taking your hamstring tendons, and so that involves making an incision down a bit lower on the knee. It's a little bit smaller and more cosmetically appealing, and I take 2 of those hamstring tendons and fold those into a sausage of tendons that becomes the new graft. That tends to work very well and is much less painful than a patellar tendon, but because it is a graft made out of tendon without the bone plugs, it heals a bit slower. And so that one tends to be more in the 6-month time frame for that graft to be healed. A newer option that has gained more popularity recently is the quadriceps tendon graft. And so that one involves making an incision above the kneecap and taking a portion of the quadriceps tendon that is above the kneecap. When I use that, I typically don't take a portion of the patellar bone, but surgeons can, although it doesn't add any benefit. And so that is also a good option in terms of very strong, good graft that doesn't tend to give you nearly as much pain or difficulty as kneeling as the patellar tendon graft does. Each of those grafts is then fixed in place by using a variety of different devices. It can be fixed in place by passing the tendon into a tunnel and then wedging a screw in adjacent to the graft. It can be fixed by placing pins that go across and through the graft to hold the graft in place. Or there are some devices that actually go into the tunnels and expand, wedging the graft inside the tunnel. Or even another option recently is suspending the graft on either end with metal buttons that suspend the graft between the 2 buttons. But ultimately, these are designed to give good, solid, temporary fixation while the graft actually heals into the bone tunnels and becomes a new vascularized graft. All of the rehab afterwards is then geared toward protecting the graft while it heals and not re-injury. Structuring the rehab afterwards is all geared toward getting back to sports, getting back to running with a very graduated progression. Each of these grafts has pros and cons. I guess the big ones are the allograft is most likely to stretch out or re-tear, and so I use that very rarely and only in people who have some good reason to do so. Hamstrings are a good graft, but do tend to stretch out a bit over time. Patellar tendon grafts are very solid and heal well, but definitely come with the most pain and most difficult rehab and kneeling problems. The quadriceps tendon is excellent and sort of fits a nice niche in terms of a good graft that stays tight over time, but isn't quite as painful as a patellar tendon. And so a lot of how that graft is chosen for you depends on what sports you play, what your job is, what your aspirations are. And so that is something that I certainly help patients with all the time in terms of deciding what is right for them. And that is a very personalized decision. I guess that those are the important things in terms of how the reconstruction goes, how your treatment options go, and I guess those are the basics. For more information, you can certainly go to our website, OrthoVirginia.com, and certainly feel free to offer questions in the chat, which I'd be happy to answer. I guess if I was going to leave you with a few tips, probably tip number one is if you are playing a sport or have an injury and you misstep, and if you have the classic pop in the knee with pain and swelling, the most important things are ice, compression, and elevation, much like you've heard before. And then getting in to see a doctor for an x-ray and evaluation. The other thing I would say is, let's say you do have an ACL tear. What makes a huge difference in terms of your recovery and getting through the process is prehab and working on range of motion and strengthening of your quadriceps muscle. That makes an enormous difference in terms of how the whole process goes. I'd say third, as far as you have an ACL tear and you're trying to figure out how to treat it, the important thing is to honestly assess what your aspirations are for sports, what your job is, how much time can you afford out of work, when you need to get back to your season to play. And those definitely help impact your decision making in terms of what you do for your ACL tear. And I guess probably the biggest thing is, once you've had your ACL fixed, work hard, follow the rules of rehabilitation, and look forward to get back to your sports. I'm back to soccer, although not competitively, just with my kids at this point. So hopefully that can be the same for you.
Perfect. Thank you so much, Dr. Thompson. And we have a bunch of questions that are coming in. Our first one is, you were just talking about the different types of grafts you could use or tendons that you could use in replace of the ACL. Do you know ahead of time, do you know ahead of the surgery which graft you will use?
Absolutely. That is something I talk with patients ahead of time about, and we discuss the pros and cons of what makes the most sense for them. And so that is something that we do decide ahead of time, and so there are no surprises in terms of what they're going to get, right? And they know what the rehab is going to be like ahead of time.
Okay, thank you. The next one is, will the patella repair work with an open growth plate?
Ooh, that's an excellent question. Will the patellar tendon work with an open growth plate? So knees that have open growth plates are an entirely different arrangement. And so there is, to drill the tunnels to reconstruct the ACL involves drilling through the growth plates, both on the shin bone side and on the femoral side. And so there are ways to drill the tunnels to avoid the growth plates, but for most cases, as long as the patient may be close to finishing growing, it is actually possible to go ahead and drill through the growth plate, changing the alignment of the tunnels slightly to accommodate for that. However, the biggest no-no tends to be avoiding the patellar tendon, because that could cause a bony bridge across the growth plate that will then influence growth subsequently. And so for kids with open growth plates, generally the best choice is to use a soft tissue graft, be it quadriceps tendon or hamstring tendons, for less risk of injuring the growth plate with consequences afterwards. But that is, again, a very dependent question based on how old the patient is and what their growth plates look like. So we'd say, ask your doctor about that one for the specific details, but that's the overview.
Okay, thank you. Okay, and this one might be very specific, but let's go ahead. If the hamstring, for this particular person, if their hamstring graft retore again after 8 months, what would be recommended as another option?
Well, hamstring is done from that standpoint, and so the options then become, you could go and get hamstrings from the other knee, although I personally would not be inclined to do that. I would say you then move into, for a revision ACL reconstruction, the graft choices are a little bit more complicated based on your specifics. But as a big picture, you're then left with quadriceps tendon or patellar tendon as good choices. Again, you could move into allograft options. However, it is in general an inferior choice, and so I like to avoid that unless it's absolutely necessary.
Okay, thank you. The next question is, what would be what would be the best repair for a gymnast?
That's different orthopedic surgeons would tell you different answers on that one. And so I would lean probably toward a quadriceps tendon in an active competitive gymnast. It's not the fastest recovery, but it is a good graft and tends to give good long-term outcomes. Although I could argue the other ones too. Okay. Not an allograft. There's only one wrong answer in that. An allograft is the one wrong answer, I would say.
Okay, very good. Okay, one person writes, you mentioned prehab, but not fully sure what that means.
Prehab, when I say prehab, what I'm referring to is doing some exercises before surgery, after injury and before surgery, in terms of getting ready for surgery. A key thing I didn't mention, which I should, is that after ACL surgery, there is a huge incidence of loss of strength and control in the quadriceps muscle, which is really important to keeping the knee happy and healthy and feeling good. And so the more exercise of that quadriceps muscle that you do before surgery, it seems like the easier the recovery tends to be after surgery. And so that's where doing some biking and range of motion exercises and squats before surgery are really helpful in terms of making the after surgery recovery a little smoother.
Okay, thank you. Our next question is there any solution for the meniscus in case the surgeon has taken out the little damaged part?
Moving into a different topic. The short version of meniscus tears is that meniscus tears can be trimmed if they're relatively small. They can be repaired if they're of the right shape and size for a repair. And in some cases, if much of the meniscus has been removed from prior surgery, you can actually do a meniscal transplant where you put in a new meniscus. But in general, for a small meniscus removal or trim of the meniscus, there's nothing that needs to be done for that specifically. That can be just sort of part of the ACL reconstruction and doesn't change the rehabilitation or make anything any different.
Okay, thank you. The next question is, will you know it when you tear your ACL like you know when you rip your Achilles?
Generally, every once in a while, somebody manages to hurt their knee and doesn't get swollen and doesn't have a lot of pain, but it's generally pretty obvious. It's the classic signs are a pop that you can feel and or potentially hear, and lots of swelling in the knee afterwards. And so those are pretty hard to ignore or play through.
Okay, thank you. The next question comes in, I have torn my ACL for a third time in the same knee. Ouch. I have some arthritis behind my kneecap. I'm an active 50-year-old. Does the arthritis make ACL reconstruction a bad idea?
Yeah, that is, as you get some arthritis behind your kneecap, that alone doesn't preclude reconstructing the ACL. But a 3-time loser on ACL starts to make me think, like, maybe there's something else going on, and just putting a new ACL in the knee might not be the best solution. There may be some other things that need to be addressed at the same time, alignment issues or ligaments being loose. Yeah, at some point, though, I would say give up and then wait for your knee replacement, which actually the first step of knee replacement, believe it or not, is actually cutting out the ACL. So although the ACL is so near and dear to my heart, it also comes out very quickly as part of your knee replacement. So at some point I'd say give up and just wait for your knee replacement.
Gotcha, sounds good. Next question is, what is your opinion about doing squats? Are they healthy for your knees or worse?
I like squats. However, I don't like going down really deep or jump squats because that puts a lot of stress on the meniscus. It does involve a fair bit of stress on the front of the knee, but it is a good way to build quadriceps strength and doesn't put quite as much stress on the patella, the kneecap, as like just a knee extension would with weights in the gym. And so it is a good option.
Okay. This question might be too specific. We're going to ask it anyhow. My 3-sport daughter has a high-grade ACL tear. She wants to play college and hopefully pro. What would be the best long-term graft for her?
I would high-grade ACL tear, I guess, to some degree, like that is it unstable? And if it is unstable, which it probably is, then I would go with the most sort of durable and reliable grafts, being patellar tendon or quadriceps tendon.
Okay, perfect. Can I still work out and be active without my ACL?
Absolutely. Although you probably can't play sports like basketball or tennis or soccer, because it's so important in giving that rotational stability that an ACL deficient knee often tends to have give out or give way and feel like it's slipping, even with things as simple as just walking around the kitchen. But straight line type activities like elliptical or bike or weights, those are certainly totally able and acceptable without an ACL.
Okay, thank you. The next question is, after an ACL tear, after I tore my ACL, I can bike and hike just fine, but my knee clicks every morning after sitting for a while. Why is this, and is it an issue?
Congratulations, you're doing a great job staying active, and that's exactly what you should do. Make your knee nice and strong. Something like that can be some scar tissue that forms just in front of the ACL as part of the injury, or might be something that's become more symptomatic that actually is a little bit of rough cartilage underneath your kneecap. And so if it's not painful, then please don't worry about it. And for a lot of that, even if it is a little bit uncomfortable, if you focus extra on quad strengthening, you can make it not hurt.
Okay, thank you. How long can I go with a torn ACL before I have to have it repaired?
Depends on how careful you are, is the question up there. So what really governs how people generally do after ACL tears is what the state of their meniscus is. And without a meniscus tear and just an ACL tear, recovery tends to be pretty predictable. However, since the ACL provides stability to the knee, if you don't have an ACL, the knee can shift. And as it shifts, you're prone to tear the meniscus. Once you've torn a meniscus, you're a lot more likely to get arthritis. And so another part of the reason for reconstructing the ACL is just to give knee stability so you don't tear up the meniscus and then go down the road toward arthritis. So it is certainly fine, to answer your question, to wait several months till the end of till spring break or winter break to reconstruct your ACL, but you certainly shouldn't do any dangerous sports during that time. It would be just simple gym type strengthening activities. It broke my heart, I have to say. One patient a few years back who was young in his 20s, I told him he needed to get his ACL done, and he waited over a year, and I don't know what he was doing during that year, but by the time we got to actually reconstructing the ACL, both of his meniscus had been so torn up that I had to trim out basically all of them, which just gives me heartburn to think about because it has such bad consequences in a young patient. And so, yeah, God forbid, please don't mess up your meniscus anymore, but it's not urgent.
Very good to know. Very good. Okay, I think we have a couple more questions. How soon after surgery can I start physical therapy?
I'm a big fan of starting physical therapy right away. I have people start doing exercises the same day, and within a couple or 3 days going to formal physical therapy and starting working on range of motion. It seems like the sooner you get started, the easier it tends to be long run, although it's kind of tough on the front end. But you just have to accept that. You'll get through it.
Absolutely. Okay, what is the safest way to strengthen your quads if you don't have an ACL?
Leg press or squats.
Okay, that's pretty simple and straightforward. It looks like it might be our last question is, do you think PRP helps repair the tear or stem cells?
That sort of delves into the realm of the bare ACL repair. A lot of surgeons, PRP is platelet-rich plasma, for those who don't know. That is a product that is taken from your blood, withdrawn, spun in a centrifuge, and concentrating the growth factors in that. Stem cells are taken from other locations in your body and are purified and have good healing properties. For ACL tears, there really haven't been a lot of big studies that show a benefit to PRP or stem cells. Although in concept, it certainly makes a lot of sense that incorporating those into a repair or into a reconstruction might give faster or better healing. at this point, I don't feel comfortable recommending it as the standard of care, although I certainly, that is something to watch, but the answer for that is not written just yet.
Okay, perfect. Well, thank you so much. If we didn't get to anybody's questions, we will circle back and answer them once this is ended and put them on a blog on Facebook by the end of next week. But Dr. Thompson, thank you so much for taking the time.
Thank you all for joining us today, and I appreciate you listening. If you have further questions, please feel free to reach out through Facebook or through our website, orthovirginia.com. But thanks. Hope you have a great day.